agenda is before us, members. We go to start with the opening and welcome, and then apologies. And then on the agenda today, we've got SASSA with us, who will give us a progress report on the implementation of the child support grant for orphans in the care of relatives. And after that, we will have deliberations. And then we will excuse the department by 6 o'clock. Sorry, and then we will do our business of the day, consideration and adoption of committee meetings and any other business. Can I have a mover for the adoption of the agenda, please?
I move, Chairperson.
Thank you, Member Chabalin. Can we have a seconder? Okay, I see Member Nkosi. Thank you. So the agenda is adopted. So for us, this let me welcome the minister. I see the minister has joined us. Welcome, Minister. Members, welcome to the session. We know we had to change the time of the session because of the plenary of the NCOP this morning, and thank you for everybody for understanding that we had to change the time. I won't be long. We've got apologies from the Deputy Minister, who won't be able to join us, and no other apology from any member of the committee. So I think we've got a full house. Can I ask that we just adopt the apology from the Deputy Minister in this meeting? Is there a mover? I don't see any hands.
I've moved, Honorable Chairperson.
Thank you, Member Nkosi. Is there a seconder? Can I have a seconder for the adoption of the apology?
Second, Chairperson.
Thank you, Member Chubi. Then without any ado, let me welcome the minister and ask for the minister's input. Thank you, Minister.
Thank you very much, Honorable Chairperson. It's always a pleasure to be in your meetings. Honorable members of the Select Committee of Health and Social Services, the Acting Director General of the Department, Mr. Mtuno, the Chief Executive Officer of SASSA, Memela Kambula, the Acting Chief Executive Officer of the NDA, Mr. Bongani Makongo, senior managers and officials of the department and entities, fellow South Africans. Upfront, Chairperson and honorable members, can I tender my apology that I will speak and then I have to go back to the house as you indicated earlier on. I just excuse myself for the time so that I can be here. I will listen a bit, but I'll have to go back to the house. And thank you for inviting me to present to you the implementation of the Child Support Grant for Orphans in the care of relatives by the Department of Social Development and its entity, the South African Social Security Agency, SASSA. Honorable members will recall that in 2011, the North Gauteng High Court directed me to devise and implement a comprehensive legal solution to the crisis in the foster care system, wherein a large number of children were being excluded from receiving benefits and adequate protection services owing to the onerous administrative design of the foster care dispensation. The requirement that beneficiaries must, through the Children's Court, extend and renew their grants every 2 years placed unbearable pressures on the state machinery, as much as it contributed to the deteriorating quality of life of the beneficiaries old and new applicants alike, if I may say. Similarly, and at the expense of equality important priorities in communities, this resulted in social workers over investing their resources in this area. Following far-reaching consultations that were aimed at realizing the comprehensive legal solution to the solution that the court directed me to formulate, and as the first step in that direction, the department invoked the 2015 cabinet-approved child support grant top-up policy, through whose provisions I'm able to introduce their higher value child support grant top-up grant for orphans. This I did in concurrence with the Minister of Finance. As a result, on the 1st of June 2022, I introduced this grant. This new approach to the comprehensive legal solution renders the back-breaking court processes unnecessary. However, towards ensuring that the orphan children continue to receive adequate care and protection, social workers would need to monitor the families that provide care for them. Honorable Chairperson and members, the Child Support Grant Top-Up is a practical demonstration of how our social protection infrastructure through social assistance innovation is being responsive to the wide variety of vulnerabilities and socioeconomic burdens that communities, families, and children in need are experiencing. In the face of the persistently growing rates of unemployment and threatening incidences of hunger, and together with other social protection services such as early childhood development, and may I indicate that this process of transition also is moving well so far, quality basic education, health and other measures, social assistance is the centerpiece of the support that families who care for children receive. This is our investment in South Africa's future. Needless to reiterate, the intentions of the sixth administration of our democratic government remains the well-being and holistic development of each child. It is for this reason that we put the child and his or her interests first. The Child Support Grant Top-Up is the practical expression of our growing investments in children. Over the years, several studies have shown the positive impact that our social grants, in particular the Child Support Grant, are having in poverty alleviation and the promotion of the well-being of beneficiary children. Honorable members, please note that by 29 July 2022, SASSA had processed more than 7,000 applications towards this grant. And Honorable Chairperson and members, please receive the department's and SASSA's presentation for your due consideration at this engagement. I thank you, Chairperson and honorable members.
Thank you, Minister, for that input. We will now also hand over then to Mr. Linton.
Honorable Chair, thank you very much, and a very good afternoon to all honorable members. I hope I am visible and audible. I'm just trying to make sure that. Thank you very much, honorable members. Very good afternoon to yourself, and let me also greet our minister and members of the department and our implementing agency, SASSA. Chair, the structure of the presentation that we've put forward, and I wonder if Maureen, you can put the presentation on the screen. While you do that, I just wanted to highlight one or two things very quickly, particularly around the makeup of families and households in South Africa. And as you would know, the structure of families and households environments is critical to the holistic development, both emotional and cognitive growth of children. And of course, parents play an important role in this journey. In South Africa, however, due to death, abandonment, and poverty, children are frequently left in the care of other relatives, such as grandparents and relatives, to provide quality upbringing and support until they reach adulthood. Just waiting for Maureen to put up the presentation on the screen. While she does that, I just want to also indicate that, of course, these children are not necessarily, may not rather necessarily be in need of care and support, but these families need income to support the basic needs of the children in their care. And members may recall, as the Minister has just indicated, that the North Gauteng High Court did instruct the Minister of Social Development to design and implement a comprehensive social legal solution to the crisis of foster care, of the foster care system rather. And of course, the process to extend the child support grant, CSG, for orphans living in the care of relatives and child-headed households was therefore initiated as part of this response. And of course, this process started in around 2012 or so and became operational on the 1st of June, 2022. And in terms of background, just at a high level, members will also note that it took about 10 years to develop and implement this policy. And of course, on the 1st of December 2015, Cabinet had approved the policy on increasing the value of child support grant for orphans in the care of their families. And in 2018, the Minister of Social Development did table to Parliament the Social Assistance Amendment Bill to provide for the legislative framework for the CSG top-up. And subsequently, the bill was passed by Parliament and then signed into law by the President as the Social Assistance Amendment Act number 16 of 2020. And the regulations were, of course, published in April this year. And this amendment empowered our Minister, of course, to, or rather with the concurrence of the Minister of Finance, to introduce an additional payment linked to the social grants based on the need. Today, relatives caring for orphans can certainly apply at SASSA for the child support grant top-up, or what we call the CSG top-up. And since implementation, both SASSA and the DSD have been reaching out to communities to increase awareness of the provision of this grant. And to date, we've crisscrossed the country, having gone to Limpopo, Western Cape, Eastern Cape, and KwaZulu-Natal. And we intend to finish all provinces within the coming days. And of course, the intention is to also prioritize rural areas in those provinces. And so to reach out to officials who are responsible for implementation of the CSG top-up, we're also conducting virtual consultations as more stakeholders can be reached across the country. Our online
Is it my phone or is it his?
It is.
Member Chamberlain, I
can also
thought
hear
it's me. I think it's his on his side that we lost him.
Honorable Chairperson, this is Brenda Sibeko.
Brenda, you can continue.
It seems like DG is having some connection problems. But,
Well, you continue.
but the presentation is ready. We're able to continue the presentation if the select committee agrees.
Now it's fine, Brenda.
Thank you very much, Chairperson. If you allow us to show the presentation, to flight it. Can we be allowed what is the rest to Dr. Maureen for us to be able to write the presentation?
I think the minister must speak for both.
No, I can't see it yet.
Okay, we can see it. Can someone from the department make contact with the minister? You. Thank you. Brenda, you can continue.
The DG has just rejoined, Honorable Gillian.
Okay, the DG can continue.
And the presentation, I trust that the members can see the presentation.
Yes, we
Okay.
can see it. The presentation is on the screen. Mr. Linton, you can continue before the department will present.
Chair, my sincere apologies. I happen to have been kicked out of the meeting. I'm sorry about that. But I think not to waste any more time, we can go straight into the presentation, Chair. As I indicated, we are here with our colleagues from both SASSA and the DSD. And so I think so we can go straight into the presentation and then be able to take inputs, questions, points of clarity, etc., from honorable members at the tail end. Thank you very much. Let's go, Brenda and Maureen.
Thank you, DG. I would like to extend my greetings to the chair and to members of this committee. I'll also extend my greetings to our minister, to also senior managers of the department who have joined us, including members of the public, and our colleagues from SASSA. Our presentation is twofold. I will start with the first part that focuses on the policy on CSG Top-Up, and my colleague Brenton from SASSA will do with the implementation aspects. Thank you. We will just give a brief rationale why Top-Up. We felt that before really getting into implementation, it will be good for us because we have never come to this committee to present on the policy itself. So it will be good for us to go through the reasons why we came up with this particular intervention. So we'll do a overview of the Top-Up, the legislative framework that DG has touched on, and we'll also look at the target group and documents that are requested for one to qualify for this particular provision. And Mr. Van Vrede will then take us through implementation of this policy. Thank you. As you know, that the child support grant, and I think Minister has indicated that the child support grant Top-Up is not a new grant, but it's based on child support grant as a policy intervention of government. So, and we know that the child support grant, we know it as an important instrument in terms of social assistance in the country. It is the biggest program in the country, taking over 11 million beneficiaries. We also know that the aim of the provision is to ensure that caregivers of children in extreme poverty can access social assistance to supplement household income. I always inform people that the child support grant is a complementary grant. It's a supplementary grant assisting the whole family in terms of what the family already has. It is both the largest in the country in terms of its success rate. It is rated as one of the successful intervention the country has. The program was introduced in 1998 and we have seen its growth, and currently it's covering all children who are from 0 to 18 years of age. We know the positive effects of the child support grant and are well documented through studies that have been done by ourselves, but also studies that have been conducted by international organizations. It's well designed, it's well implemented, and you will see later that its growth, that is why even today we are seeing that the growth of CSG, it's higher than all other grants that we have. What is the rationale, or where did we start with this particular top-up? We know that in 2011, the North-Southern Court required our minister to design and implement a comprehensive legal solution, and minister has already alluded to that effect. The foster care system at that time could not service all children. It was overwhelmed by the number of the children in the system. It was not able to keep up with the demand for new applications, and we were taken to court. And by doing that, it was also not able to keep up with extension orders, because according to foster care provision, extension court orders need to happen after every 2 years. It led to then the exclusion of a large number of our children in need of protection services. At that particular time, the department commissioned work in terms of reviewing our provision for children in alternative care. And one of the recommendations of that work was to introduce a CSG top-up. In fact, the study proposed kinship grant or CSG top-up, and as a department, we chose to proceed with a CSG top-up. As you will see in this particular graph, you will see that from 2011, we started seeing the number of beneficiaries going down. You will see that we were in 2011, we were above 500,000 beneficiaries, but currently we are below, just below 300,000 beneficiaries. That shows you how the backlog in the foster care system affected the foster child grant, because the foster child grant is the last process in the foster care process. So if the foster care process is not able to absorb enough numbers of children, it affects the foster child grant take-up. This particular provision or this particular graph shows you the growth of the child support grant against the decline in the child support grant. You will see that in the blue color represent the child support grant, and you will see that the child support grant is continuing to grow. Even now, it's still steadily growing. And that is why we opted for using the child support grant rather than the kinship grant. And you will see that with foster care provision, it was going up, but when we reached 2013, we started seeing a decline in the numbers of application of foster child grant. What did we do as a department? We started engaging in rigorous consultations with relevant stakeholders in provinces, different provinces, as proposing CSG top-up as the first step towards the comprehensive legal solution. And as I said earlier, this particular policy is not a new grant, but it builds on the existing child support grant. So what does it mean? It means that the rules of child support grant are maintained. So we follow the rules of the child support grant. What we have added is just a number of documentation in order to target this group that we are targeting. This policy was approved by Cabinet in 2015. However, it was not easy to implement. We had to wait until 2020 when legislation was approved and was gazetted, and it was only in 2022 that the regulations were adopted. It took longer for us because we had to obtain funding for this particular provision. And this provision was only given to us in this financial year. So as you know, we started implementing this particular provision on the 1st of June, 2022. And the value is determined by the minister in concurrence with the Minister of Finance from time to time. As you know, all of our grants, the values of the grants are done in concurrence with Minister of Finance. And this provision, it's quicker, unlike the foster care or the foster child grant provision, because access to this provision requires not a court process, not the long social work process for placement. This means that if a grandmother, a brother staying with an orphan, they can go straight to SASSA to apply for this particular provision. However, in order to ensure that adequate care and protection is maintained, social workers need to maintain this family. So in the policy, we have emphasized that it is important that every SASSA needs to give provinces the database of all beneficiaries, so that if there is a need for assessment, provincial department can allow social workers to do that. As I said, it focuses on orphans in the care of their relatives. Here it will mean children staying or orphans staying with their relatives. It might be a grandmother, it might be an aunt, an uncle. It's seen as an important part, as I said, of the legal solution. It enables these relatives caring for orphans to get an adequate grant. And in this instance, we are saying that the grant is 50% top on the basis of, or the base child support grant provision. So we know that child support grant is 480. The 50% of 480 rands is 240 rands. So all in all, these children will receive 720. But if it happens that in next year, the grant increases to another amount, we will go with 50% of that particular amount. But currently, the grant is set as 720, and it's quick because the beneficiaries or the applicants can go straight to SASSA to apply for this particular provision. What did we do as a department? As a department, we developed a practice note because we realized that it might not have been easier for for social workers as well as SASSA to understand this particular provision. So as a department, together with SASSA, we developed a practice note, which we started distributing in April to all social workers and SASSA officials, as well as other relevant officials, which explains how this particular provision is supposed to be processed. We are saying here, orphans already in the foster care system are not affected. This means that orphans already in the system or who are already receiving the foster care, the foster child grant, will continue to receive the grant. Our intention is not to remove them from the grant. And that is why currently there is legislation before the portfolio committee with an in session where we are saying that this particular group of children should remain in the foster care system, and it's a transitional clause of all those children who are already in this particular system. So as I said, no assessment is required prior to awarding the Csg top-up. This applicant should be referred to SASSA. Here we are referring to those that go to social workers. They might not be knowing that they qualify for this particular provision. So we are saying that these social workers need to refer them to SASSA. Unless if there is a protection or care issue, we know that foster care is meant for children in need of care. Csg top-up is for families who are in need of income. Those children are not in need of care, they are well taken care of. But for children who are in need of care, social workers need to attend to these children and intervene with the right intervention. If foster care is the right intervention, social workers will make that determination. So those children who are abused, who are neglected, who are exploited, they're not supposed to be directed to SASSA. Only children from child-headed household need to obtain a form from social workers. Remember, this particular provision is for orphans in the care of relatives and orphans who are in child-headed households. So we are saying for children in child-headed households, for this group of children, it will be difficult for SASSA officials to know truly that these are children from child-headed households. So we are saying for these children, they need to via social workers' offices so that they can receive a form that they can take to SASSA to apply for the grant. Already the department has developed that particular form and has been shared with all social workers in 9 provinces. The DG went through our legislative framework. I'm not going to go through this slide. What is important in this slide is that this particular provision, we started on the 1st of June, 2022. What is important in this particular provision is 3 definitions that are new, that were not there in the previous Social Assistance Act, and these are relative, orphan, and unknown status. And that is why we had to amend our Social Assistance Act so that we could insert this new definition. The first definition is the definition of a relative. So in the context of social assistance, a relative in relation to an orphan means a grandparent, a brother, a sister, an uncle, an aunt, or cousin of the child. A brother or sister might mean a sibling who stays. Remember, in child-headed household, you'll find that there is a elder brother or sister who is over 16 years taking care of their sibling. They will be able to qualify for this particular provision for themselves, also for their sibling. This definition does not include adoptive parents. Why? Because adoptive parents are same as biological parents as well as step parents. Remember, this provision is for orphans, so it does not cover that category of parents. An orphan is a child who has no surviving parent. This definition is based on the Children's Act. So we are going with what is already in the Act. How do we unpack this definition? We are saying that it means both parents are deceased. So this definition, we divide, we describe 2 categories of applicants. It will be a grandparent who both a child has passed on, and also the son-in-law has also passed on. So this means that both the parents of these children are deceased. So the grandmother will bring the 2 death certificates to SASSA when they apply. But there are cases where one of the parent is deceased, but the other is not caring for them. That is how we unpack it, and I will explain it later. And it is explained by this 3rd definition, which is unknown status. It means that it is not known whether the person concerned is dead or alive. So the grandmother cannot attest to the fact that this person is dead or alive. They have never met them, they've never seen them. Let's say that I normally give this example. It's really described when you give an example with this one. For example, a grandmother might be staying in Rustenburg with her daughter, and her daughter before that went to Cape Town to look for a job, or maybe Eastern Cape, was working at Eastern Cape, and she fell sick and she comes back home. And when she comes back, she is pregnant and she gives birth to a child. After that, giving birth, she passes on. So this grandmother has never met the paternal side of the family. So they can never attest whether the person, the father of that particular child is dead or alive. So it's only in that case that they can complete a SASSA affidavit to effect that they do not know whether the person is concerned, the person concerned is dead or alive. But if the family, the grandmother knows that the father is somewhere in, if it's Rustenburg, is somewhere in the village in Rustenburg, for example, Phuke, or any other village there, or maybe somewhere in Bretts, they know their whereabouts, they cannot apply for this particular provision. That type of a family need to apply for the normal CSG. Who are the target group? The target groups are orphans in the care of relatives or orphans in child-headed households. I've already explained this one. Who can apply? The relative can apply. I've already explained who is a relative in this case. A child who is 16 years or older, but under 18 years. These are siblings that I spoke about. And this child is taking care of their sibling. This particular category focuses on those children who are in child-headed household. We are saying that according to our regulation, this particular child who's 16 years up to 18, they can apply for the grant for themselves and they can apply for their siblings. So if they are 6 in the family, they can, and the older brother is the 6th one, they're going to apply for the grant for themselves and the 5 siblings. So meaning that all 6 children will receive 720 each. Documents that are required to apply. So normally the first category is the existing CSG, where we will request the ID, we will request the birth certificate of the child. And in the case that you do not have IDs, we also provide for alternate document, which is a SASSA prescribed affidavit, a letter from the principal, and so on. And in terms of CSG top-up, we are saying that for a family to apply, they need to produce certified copies. I've already spoken about this, of the child parents, or where one of the death certificate cannot be obtained by the applicant, a copy of a death certificate of the child's parent, and then SASSA affidavit. I want to emphasize that it's a SASSA affidavit because we don't expect beneficiaries to go to police station. They can go to SASSA, and SASSA has a SASSA affidavit where they can complete attesting to the unknown status of the child's other parent. And we also need a form from social workers if it's children in child-headed households. And I'm now going to allow Mr. Van Vrede to proceed with CSG top-up implementation. Thank you.
Good afternoon, Honorable Chairperson, honorable members, Minister, DG, CEO, colleagues, members of the public, greetings. As Dr. Mahotsi mentioned, I'm going to briefly take us through implementation and some of the teething challenges that we've had over the last month or so since we've been implementing this grant, and some of the progress we've made, as well as some of the amendments we're going to be thinking about how we can target this grant a lot more, or market this grant in a much more targeted manner. So just in terms of implementation, I think let us skip this slide because I've got a slightly more updated slide, Maureen, on the next slide. So in terms of our targets that we've set, we were looking at targeting about 191,000 children by the end of this year. But note that the legislation for this grant was only published late in the first quarter. So our first quarter target was we haven't come close to meeting that. And I think we may have slightly over projected or been a little bit ambitious in terms of the speed at which we would be able to ramp up implementation of this grant, but we do have some ideas on how we can increase the pace at which we market and hopefully get clients to come in and apply for this grant. So we were looking at a target of about 19,000 for the first quarter, 57,000 for the second quarter, increasing to about 115 in the third quarter. And as mentioned, by the end of the year, we were hoping to reach about 190,000 children. Next slide, Maureen. I think
I'm going to stop sharing to allow you to share your screen. My apologies.
Okay. My apologies, Chairperson. Let me just go to the slide that we were on. Okay. DSD colleagues, if they could mute. Okay, so just in terms of progress, up to August, this was last week. Sorry, it's about 2 weeks ago. We managed to get and approve about 7,500 applicants across the country. And then also just to give you a sense of the regional breakdown, we processed most applications in the Eastern Cape, about 1,800, followed by KZN, 1,700, and then roughly 1,000 in Limpopo and just under 1,000 in Gauteng. And then in some of the smaller provinces, smaller numbers have come through. So in terms of challenges, I think the first thing that we maybe want to notice that when we implemented this, it's been a while since the COVID SRD grant came about in 2 years ago, that SASSA actually had a new grant. We sort of for the last decade or even decade and a half just had these existing grants that we did have. So this both the COVID and this grant was for the first time in a while that we really had to then begin to build new systems or even begin to change processes significantly for the implementation of these two new grants. And also another challenge was that in the current year, we were pretty much implementing two big changes roughly at the same time, having to implement the new version of the COVID SRD grant, which was quite a significant change from the previous version of the grant, as well as this grant, a much smaller grant in terms of the number of people, but also requiring quite a bit of system changes, and more importantly with this grant, because it's manually, not manually, but it's a face-to-face application for most part, as with our other grants like the child support grant and so forth. We also have to drive quite a lot of change management within our offices. So we did have a little bit of a stumbling block at implementation. I wouldn't necessarily say a stumbling block, but there was a week or two delay in terms of just getting the systems ready and getting the regions ready for applications. So in that first week or two, we had to take manual applications just to ensure that our offices were open and available and that we weren't turning away anyone for applications. So in most instances, we haven't turned anyone away. There are some incidences where for example, a security guard didn't quite know about this new grant, and when someone approached the office, they may have turned someone away. But in most instances, all our offices were open, even when the systems weren't quite ready for implementation. We were taking applications and processing them manually. But most of that is done now. Systems are up and running. We have conducted training throughout the organization, but again, training is ongoing. Just today, we got some reports that someone has been giving misinformation out. So it's again, it's that system of change management, continuous training, and we do also have quite a strong civil society partner that works with us and is in our offices in many of these regions, especially in the more rural areas like Mthatha, where they pick up challenges and they feedback this quite regularly to us. It helps us then to address some of these issues as they come up. In terms of our referral processes with DSD at the moment, we're also still running a manual process. So there's two interfaces we do with DSD, as Dr. Mahotsi mentioned. The one is after a client is approved, we refer all of these clients back to DSD. Not that they need social work intervention, but that at least that there should be some level of social worker oversight over these households, and if need be, as she mentioned, if there is a child protection issue that comes up, then obviously the social worker will intervene. But we also provide this grant to child-headed households, and in those instances, we do need a letter from DSD to confirm that the household is a child-headed household or registered with them as a child-headed household. So those are two areas that we still have to look at in terms of automation. That's again still a very manual process. Our training manuals are, as with always, again, like I said, the last time we really implemented the new grant was the child support grant way back in 1998. But if one just reflects on that time period as well, those early days of implementation, even for the first year or two, you're continuously updating your training manuals and refining them as experience and implementation practice on the ground. As you get more aware of the challenges on the ground, you also then come up with various solutions and you update your training materials and your manuals to accommodate that. So that is a normal process of continuous refinement that we'll probably be going through until they become a lot more perfect over a period of time. And then the big challenge we have, obviously, as I mentioned earlier on, is that the targets we set may be a little bit optimistic. Even when we implemented the child support grant in 1998, the uptake in that first year was very, very low. But then once people became more aware of it, we began to get a lot more momentum. So we are looking at increasing our marketing activities on this grant so that communities and become more aware of it. We do also rely quite heavily on DSD referrals, so social workers who would probably be your first interface for new clients would then refer these clients to us as opposed to the foster care system. But we're also looking at some more targeted marketing. So our technology teams are also looking at how we can extract some of our existing software data and CSG, our existing CSG clients, and trying to study and analyze that data to see which of the children currently receiving CSG may have had a caregiver change in the last couple of years, which could be an indication that the caregiver that was taking care of them, especially if it was a biological caregiver, could have died, and thus be an indication that the child could be an orphan. And once we analyze that data, that then would enable us to be able to send SMS messages out and have a more direct form of marketing to potential clients for this grant in that sense. So just in terms of the last couple of months, probably the last month or two that we've been implementing this grant, as I mentioned earlier on, it's been a while since we actually had new grants to implement, and the COVID SRD and this grant has actually given us some good, interesting experiences. But obviously this grant was a little bit overshadowed by the COVID SRD grant, which is just a lot more larger than this and has a lot more challenges to deal with than this grant. But I do think we have hit the ground running. We are available. All systems are available for taking on applications. It's just a case now of getting or marketing this grant more effectively and getting more clients to come into our office and apply for this grant. As mentioned also, I think a lot of the challenges we are experiencing is sort of normal teething challenges one gets, noting that SASSA is a very, very large organization. So even though we have done training across all our regions, it's going to be a while until it really just sinks in to most of our staff that this is a new grant, this is a new set of processes. As I mentioned, even all the way, not just our staff taking applications, but all the way, for example, to security guards that stands at doors, etc., to make sure that nobody turns nobody away. And so maybe, for the next while or so, we probably could still experience some of that But as we continuously train our staff, as we continuously send out the reminders and updates and material to our staff on this grant, and have regular engagements and management engagements and so forth, that kind of change in culture will also then filter through the organization. We shouldn't have too many of some of the challenges that some people have picked up. This grant also requires a very good working relationship between SASSA and DSD. Now, fortunately, we do already have a whole, in all our regions, we do have set forums that deals with foster care, and we will take into those forums matters related to this grant, because this grant does require that referral between DSD and SASSA on a number of issues. So we do need to, and also DSD is also a sort of gateway to this grant, not in the sense of foster care where this needs a whole lengthy process, as Dr. Mokotsi mentioned, but DSD does also play an important role in terms of provincial DSD does also play an important role in terms of referrals, and so we also do need that kind of change management amongst the DSD staff, especially social workers who are probably very set in the traditional way of dealing with foster care. I do think the amendment to the Children's Act, which will hopefully be passed later on this year as well, will also help foster in some of the changes we need to see on the DSD side in terms of influencing how social workers refer cases to foster care or to this grant. Then I think just the last point.
Can you please mute? Lemon Kosi, can you please mute? Thank you. Okay, you can continue.
Thanks, Honorable Chairperson. And so I think the last point I just want to mention is that we also we do have various citizen-based monitoring forums, and we also will now include the monitoring of this grant with the various civil society organizations that we meet on a regular basis. And many of them often do, would bring a case study to us or so forth, and we'll be able to unpack the challenges that an individual experiences, and then look at how we can improve our systems to try and make access or to improve or make access a lot more efficient. So maybe just to conclude, I think just to mention that social protection, that social grants on its own is not the silver bullet, but it operates within the broader context of social protection. And for a child to develop adequately, one needs a whole range of interventions, such as education, identification, health, transport, social development, including social assistance, and nutrition support, as well as access to various services provided through the child protection system. So, Honourable Chairperson, I'd like to conclude there with the recommendation that the Select Committee notes the implementation on the Child Support Grant Top-Up and the progress that we've made to date. Thanks, Honourable Chair.
Thank you very much, Chair. That brings us to the end of the presentation. I wanted to check before we hand over back to you, Chair, whether the CEO would want to add anything from her side. CEO, just before we hand over back to the Chair, is there anything you'd like to add? Okay, maybe not. Chair, thank you very much. We'd like to hand over back to you at this point. Thank you.
Thank you, Chair.
Oh, here comes the CEO.
Yeah, no, I just wanted to highlight, good afternoon, Chair and members of the committee. I just wanted to highlight the fact that we also have other forums within the organization, which we will use to also monitor to make sure that the performance is happening in all the different regions. We have a forum where we sit with all the regional executives, where we'll also track as to what the performance is in each and every region. But also we have another structure called HOST, which is all the managers responsible for grants in all the different regions. We'll also ensure that we also monitor using that forum to make sure that performance actually does happen and also to be able to ensure that where there's blockages, we can enable communities to be able to access this grant easier. Thank you, DG. Thank you, Chair.
Thank you very much, CEO. Honorable Chair, thank you very much once again, and members.
Okay, thank you very much, DG. Members, that was the presentation. I'm awaiting any hands for clarity seeking questions or to go into a discussion. I only see the hand of Member Christians. You can continue. Member Christians, we can't hear you. There's a lot of interference. I think it's the wind or something. We can't hear you. No. There's a lot of interference. Maybe if you move to another area, allow another member, and then we can come back to you. Is there any other member want to raise a question? I don't see any hands. Or just an input.
Chair.
Member Tongeni.
Yes.
Okay.
Sorry, Chair. Thank you very much. So it's my turn now.
Yes, my dear, you can continue.
Okay. Thank you, Chair. Good afternoon, members. Hey, I've got a problem, Chair. Sorry, Chair, I have a problem. Just a minute, Chair. Anybody?
Yes, Chair.
Member Chabale.
Yes, Chairperson. I just want to check for myself, you know, poverty in most cases makes children go to school, particularly orphan children. They go to primary school at a very advanced age. And as a result, by the time they are over the age of 18, they are still at school. And which means then they fall off the grant, you know. Is there something, for instance, that could be done to look at such cases, yeah, and make some interventions? I don't know if my question is, if I was audible enough.
We did hear you, Member Chabaleng. Can I come back to Member Dongeni?
Okay, thank you, Chair. My question is, media reports indicate that SASSA in KwaZulu-Natal has undertaken a review process to ensure that grant recipients are deserving of the support they receive. In the report, it is reported that 38,000 grants have undergone SASSA review process. These reviews has taken place for several reasons. However, these reviews by SASSA has resulted in the suspension of grants. Can department elaborate on these media reports? Has research been done to follow up on former CSG and FCG beneficiaries? What are the overall intent outcomes of social assistance program geared at the at providing support to children. Thanks, Chair.
Thank you, Member Dongeni. I don't know who is iPhone.
It's Member Suli. I'm sorry, I can't rename my.
Okay, Member Lutuli.
Greetings and my apology for the video and for not renaming my gadget properly. And good afternoon to everyone. No, I think our Honorable Ndongeni has covered me a bit, but also, you see, all hello, can you hear me?
Member Lutuli, can you repeat your question because you lost you at some time?
Okay, thank you. No, I was saying that majority of the people in KZN have been declined. They saying no, they don't qualify, but there are no reason given to them because they've been receiving these grants and then now it's been cut off without reasons. So I wanted to know from the department what are the causes and where can they get clarity on why they don't qualify all of a sudden when they've been getting this grant all this time. Thank you.
Thank you, Member Lutuli. Member Christians, are you back?
I am back, Chairperson. Can you hear me now?
Much better.
Thank you very much, Chairperson. Chairperson, my question is just with regards to the performance. And really, I just first of all want to welcome the presentation because I think seeing to our children is one of the most important things that we can do right now. It was mentioned that there were 7,000 applications done to date, and that the performances of these applications are being tracked. In other words, the amount being tracked, etc. However, I didn't really hear from the department with regard to the tracking and tracing mechanisms for the beneficiaries of these grants. So, clarify, my question is whether the beneficiaries are in fact the beneficiaries who are being taken care of with the intended money, the children are actually going to be benefiting. Are those children being tracked in terms of their well-being and welfare? In other words, is the money that has been intended to them actually getting to them and actually assisting them? And then with that, I want to link then, are there enough social workers to implement that grant and to track and trace whether the intended beneficiaries are actually getting the grant, making use of the grant and seeing to the well-being of the child? Are there enough social workers then to check that the beneficiaries are being cared for? And then just lastly, in terms of the rise in children who are actually on the street currently, I think it's no secret that we've seen over the pandemic and after the pandemic that there has been a distinct rise in the number of children who are homeless and on the street. Will this grant benefit these children? Are we tracking how many children are actually homeless and on the street and how this grant can benefit these particular children? Thank you very much, Chairperson. Those are my questions.
Thank you, Member Christian. Member Chamberlain is at an old end. Member Chamberlain. Member Chamberlain is at an old end. Can I continue? Okay. Let me hand back to the department to answer the questions raised by the members.
Thank you very much, Honorable. Thank you very much, Honorable Chair. And thank you to members for the questions. I'm going to suggest that SASSA starts with responses, particularly around the concerns in KZN. Then I will ask Brenda and Maureen to come in on the other questions around tracking and tracing, the adequacy of social workers and whether homeless children on the streets will be able to benefit from this process, as well as dealing with other issues around the intentions of the policy and so on and so forth. So I would suggest that we get Brenda, we get SASSA to come in first, and immediately after SASSA, Brenda and Maureen will come in to provide responses to the balance of the policy questions. Thank you very much, Chair.
Member Chabaling, can you mute, please? Chabaling, thank you. You can continue.
Thanks, Chairperson. So I'll deal. So so the first, one of the questions was about reviews that are taking place in KZN. These are not only in KZN, but it's across the country. And what has happened was that last year, roughly, I think it was October, November last year, we've ran our databases against the public servants databases, the PASEL, the PASOL databases, and we found that there was a number of civil servants who were receiving social grants. And so what we've done was then we've implemented reviews. Now, according to the legislation, what one does when one implements a review is you'll give the person 3 months to then come to a SASSA office to present to themselves, present a refresh of their documents, so that one could then assess whether or not they still qualify for the grant. All of these applicants were then given 3 months to do this, probably a little bit longer than 3 months. After that, I think we reviewed about 167,000 cases, and then about 60,000 or so people came forward during that 3 months. When people don't come forward, then we send them a letter saying that we're going to suspend your grant, and we give you another 3 months to come forward before your grant gets suspended, which is what we've then done in, I think it was May this year, that we then issued those notifications to people to come forward, stating that we will suspend their grants on the 31st of July, should they not come forward. So people had more than 6 months, even a little bit longer, to come forward and then bring forward their documents that basically to indicate that they still require this grant. So all of the people that haven't come forward, we have then suspended their grants on the 31st of July with a final warnings or final notice basically saying that you've now in your last 3 months notice period, so that's 9 months in total, you're in your last 3 months notice period, that if while your grant is suspended, you can still come forward to SASSA and obviously supply all the necessary documents, and then we will reinstate your grant and obviously back pay you to the date that it was suspended. But if you don't come forward now in this final 3 month period, your grant will then be permanently suspended, not suspended, terminated, in which case, if you still qualify for the grant, or you believe you still qualify for the grant, you will have to then reapply for the grant. So that is the legislative process for the conducting of reviews, which we followed. And we've just got a new set of files from the AG as well in this current year, which is also another substantially large number of public servants who have spouses that work in the public service. So applicants who have spouses that work in the public service who also may not be qualifying for the various grants. And so we will start those reviews, or we're commencing with those reviews very soon. But noting that the legislation has changed with new rules, the new legislation that DSD published in June, the actual time periods are no longer 3 months for notices, and they have been reduced to 30 months. So we will be moving a lot faster through the new round of reviews for that. So I'm not sure the member Tuli had a question around many people who were getting grants and they've now been declined. I'm not sure if that it is referring to the reviewed cases, or if she's also referring maybe to the COVID SRD grant. Now, we do have a number of people on the COVID SRD grant that was getting the COVID SRD grant in the previous iteration of the grant, that may have applied in this third iteration of the grant and may not have been approved. And the main reason for most of the people who have not been approved in the third round of this third iteration of the grant is because in this new round, we've a new piece of legislation was promulgated that requires us to check incomes. In other words, in the previous round, there was not a means test implemented for this grant. We only checked databases such as UIF and SARS and so forth. In this new round of the grant, people must have income below the threshold, or below a specified threshold, and we check people's bank accounts to see how much money they get into their bank accounts, and if the money they get into their bank accounts is less than the threshold, then they'll be approved. If it's higher than the threshold, they'll be declined. We do this on a monthly basis, so it could be that in some months, especially where people aren't maybe necessarily getting regular sources of income, it could be in 1 month that they would get some form of money into their account, but in another month they don't get anything, or money below the threshold. The new threshold that was published in August is 624 rands, which is aligned to the food poverty line. And so that is probably the main reason why many people who previously got the COVID SRD grant may be declined in some months going forward, or during this new iteration of the grant, if when we've checked their bank accounts, we found that they did have income that was above the threshold. DJ, I'm going to hand back to you. I think that's the 2 operational questions.
Thanks, Brenton. Let me give Maureen and Brenda. Maureen first and then Brenda. Thanks, Brenton. You're muted, Maureen and Brenda.
Gigi, thank you. I'm going to start with a question on our grant abruptly ending at 18. Yes, it's true that the child support grant ends at 18, and we did try in 2019 to make a proposal to extend the grant to 21, but we did not get support. Remember, our proposal needs to go through different stakeholders, so we're not able to get funding for that particular proposal. So the proposal was abandoned. So we are aware that there are children who are still at school who might not have completed their basic education and are still at school. Unfortunately, at this stage, we are not able to cover those children. Except through other provisions that are there. And currently we have SRD, COVID SRD grant, and we are saying children 18 and above might, children and individuals 18 and above might apply. So those children could apply for the current SRD provision. In terms of the question on assessment, yes, we do not assess children to receive a top-up grant. However, in my presentation, I did mention that assessment still happens, but it happens after the grant has been awarded to a family. So what we do, we provide database to different provincial departments, and social workers will assess the children if there is a need to do so. In terms of children who stay in the streets, remember the provision is for caregivers who are living with the children. So it's for a grandparent, it's for an uncle and aunt living with the child. So it's given to a caregiver. So in the case of these children, they will not be eligible to receive this provision because they are not staying or residing with a caregiver. So in that instance, social workers need to intervene. Remember that provision is income support for children in the care of relatives. However, it does not put aside other intervention of social work. So children who are living in the street, there are relevant intervention where social workers can come in and assist. Thank you. I think that covers it, DG. Thank you.
Yeah, DG, perhaps Isabella may be able to add some comments on some of the issues that were raised from the social work perspective.
Good day, Chairperson, and good day, DG members, Minister, and colleagues. May I check if I'm audible? Hello? Am I audible?
Yes, we can hear you, Isna.
Okay. Members, if I may strengthen what Maureen has spoken about in terms of children living on the street, as the department, together with partners, we develop a strategy for children living and working in the street. And in that strategy, we have prescribed shelters for children living and working in the street, where children are being assessed in those shelters to determine why are these children on the street, and the possibility of those that have got families to be reunified with the families. So once we know the reasons why children are in the street, if they've got families, we check their family circumstances. We try to work, the reunification program that will assist in ensuring that, we create suitable environment for these children, to return back home. And for those that do not have families, we ensure that they are being placed in alternative care in terms of Section 150 of the Children's Act. That's with regard to the strategy for children living in the street. Now, when we go to the issue of whether we are able to, so we've got enough social workers to trace as to whether the money is being utilized to the welfare of the children. The answer is no, members. We all know that we've got, a challenge with a number of social workers that we are having, in a country, owing to the social ills, that are confronted us as the country. Now, all what we are saying is that currently we've got different types or categories of social service practitioners that can be utilized and work together with the community. And we can also say that even though we've got social service practitioners, they're still not enough, but we can work together with the communities to ensure that if we've got such cases where children are abused and they identify that, children are not abused and the money is not utilized to the welfare needs of the children, it will be critical that they report, such to us. However, we are saying that it is also important to work with everybody in the community, especially influential people in the communities and structures, your churches, your churches, your community leaders, such as your ward councillors and so on, so that they can be able, to assist us in terms of ensuring that we monitor that this money is being utilized to the welfare of the children. Thank you very much, members.
Thanks very much, Isabella. Brenda, do you have any further comments to make? Or I can add just one or two. Brenda, do you have any comments?
DJ, I think Isabella dealt with the issues adequately. Thanks, and the other colleagues.
Okay, I think just to embellish one or 2 points, Chair. Firstly, I think what Maureen spoke about with regards to the age of social assistance, insofar as grants is concerned, we haven't abandoned the proposal of moving beyond 18 years old, 18 years of age. It is something that remains on the table, which we will still look at again, because we do think that after 18, there is a level of support that needs to be provided. But of course, we have to engage with various stakeholders, as Isabella indicated. And we haven't abandoned that process completely. It is something that we are revisiting and will be continue revisiting and engage with various stakeholders to see how best we can move on that. I think on the homeless children, One of the things we've done is that we've done a very quick rapid assessment on the state of homelessness in the country at the moment, and particularly various factors that affect people who are homeless. That is going to assist us in crafting a much more clearer sort of roadmap in terms of how we assist as government on the whole persons who are homeless, and more so COCTA, ourselves, Human Settlement, SALGA, all have a very critical role to play in that regard. And so this is something that we are still very much at infancy stage developing at the moment, which we will obviously at some point come to the committee to share progress on that. Then I think the one key thing that is important is that whilst the numbers have not been fantastic, it's been a very short time since we started opening the top-up grant. It's only been about 2 months, and we are intending on going on a very massive communications drive to make sure that we get the word out there. We're able to get more people to apply for the grant and benefit from this additional social security provision by government. And I must say that we've had as a country very progressive social security provisions that we've put forward, and I think we are amongst one of the largest on the African continent in terms of our various social security provisions, particularly in terms of grants. And so this we're very excited about this top up. It will bridge the gap quite a bit and really assist those families who are in need of this particular support. So Chair, I think I would like to leave it at that from the department side. We'll conclude on that note. Thank you very much once again to all members for the questions asked in this regard. Thank you.
Thank you, DG. Members, is there any follow-ups? If there is none, let me take the opportunity to thank the department and Minister Zulu for honoring the invitation to come before the Select Committee. Thank you also for the presentation. Sorry. Thank you also for the presentation that was done, and to all the different stakeholders that were present. I want to thank the members who was attending this meeting, and also our staff members for their support. On that note, we can excuse the department, the DG with these officials. You are excused from this meeting, and thank you once again for enlightening us on where we are with the child support grant for the foster children. Thank you very much.
Thank you, Honourable Chair. Thank you, Honourable Members.
Thank you, Chairperson. Let's leave.
Members, we did receive this minutes. So the minutes is on of the 23rd of August, and the agenda was also a briefing by SASSA. The report on the SRD grant provision and interventions and consideration and adoption of the committee minutes. The only apologies was Member Baga and Member Latuli. If there is no corrections that needs to be made, I'm going to ask if there is anyone who have any correction on the minutes. I don't see any hands. Can we then move for the sorry, for for someone to go for the adoption of the minutes.
I move for the adoption of the minutes, Chair.
Thank you, Member Chavaling, and the
I
seconder.
second the move.
Thank you, Member Kosi.
I second
So the minutes is duly adopted.
Honorable Chair.
Thank you. Marcel, is that the only one?
Yes, Chairperson, we are on track with our minutes. Thank you.
Thanks a lot. Any other business, any member who wants to raise something? If not, members, this meeting is adjourned. Thank you very much.
Thank you, Madam Gillian, Chairperson.
Thank you, Chair.
Thank you.
Thank you. Bye.
Bye-bye.